Hey everyone, in this video we're going to cover a great way to add hip extension to a stiff hip. Now, there's a few progressions that we may end up doing with this. I like to first start with the very basic one that people have, and this is going to be the kneeling version. You obviously want something for your foot, your knee here, just to cradle it and so it doesn't get beat up. But the first thing you do is just expose the hip a little bit to some movement. Now, I know a lot of people do that couch one, where the foot is up. I do not suggest that for the hip capsule if we're trying to add hip extension. If you have an issue with the rectus femoris muscle, that would be more particular for that. But if you put that up, you may limit how much hip extension you'll get, which is not the point of this one anyways. So at first you're just going to rock through a little bit, kind of like so. Now at some point, one of our trainers may have told you, like, I want you to do this particular one. In that case, follow those directions, but I'm going to show you all of them here. The next one is going to be, you're going to take your foot and you're going to creep out. I call this pre-tensioning. And so we're going to creep out quite a bit. Put your elbow on your knee, just like you're the thinker. Hand right here. And then now you can see my hip is already in a pretty good stretched position to start with. Before I actually start to dip the hip, almost like there's a paintbrush, I'm trying to dip it on the floor right there if it was attached to my hip pocket. The pace is going to be pretty simple. It's going to be touch and go. Touch, go, touch, go, touch, go, and so on. Typically we end up doing about 20-30 reps per time that we do it, but obviously follow the recommendations by your trainer. A lot of people end up doing about 80, 100 to 120 reps a day for a period of time before they start to remove this from their program. Now the other thing you can do is you can actually add a little bit of internal rotation as well. So right now my foot is actually behind my knee here. You can slightly put that outward to add hip extension, which oftentimes when you add the hip internal rotation rather, and then we're going to add hip extension just as we were. So a lot of people, when they do this enough, they actually regain the ability to also flex and internally rotate the hip as well. So this one tends to help out with that scenario. Okay. Now if you're having problems with this too balance-wise, you can also take like a foam roller here or a table, which I have on the wrong side of me obviously, and you can put it here, and then you do the same thing. Okay. Now something I don't want to see is a bunch of lumbar extension. There's other stretches where you're doing stuff like this and so on. This is not this one. That one incorporates other tissues above into the low back. And I would rather remove the low back from the equation anyways. Okay? So we have these ones first. Now if you want to add a more ballistic version to it, we can add hand pressure, but also we can use the bench. So the hand pressure one is simple. Here, here, and then push it forward. Every time getting to the end range of the extension that you have. Because if you're trying to stretch part of the hip capsule here, you kind of have to stretch the hip capsule. You can't do just a partial range of it. All right? And the last one we have is a bench supported version, just like so. This one, I'm going to show you on both sides because I think it's important to see where the other leg is. This leg is going to be the non-stretched leg, obviously, and the other one's going to be back there and so on. The reason why this leg is in front here is because it limits how much lumbar spine extension you get. We call this a semi-lumbar locked position. And then we're going to push ourselves up like so. And because that foot is up there, it limits how much of this force goes into the low back. It's going to go into the other hip more so. Now, you can see I'm obviously I'm off of the bench here. You may do this on a bed. But when you do it, you may have to actually add that internal rotation part again, which I'll show you on the other side. Okay? So now just imagine I have more bed here, okay? So you see my foot there is actually hanging straight down, but also my toes are in now, okay? When my toes are inward, that is internal rotation of the femur. The other leg is up. We're going to go through the reps just as we were, and you want to make sure the flat of your foot on the outside is actually in contact with the bed, okay? The other leg's gonna be off of the bed. You can actually go pretty aggressive with this if you don't have any pain. Notice that when I'm doing these, I'm actually not screaming or really straining at all. It's because these don't hurt. It doesn't mean my hip isn't tight, like I'm not stretching it, but under no circumstances that I can think of should we fight through pain when we're doing this, but it may feel a little stretchy in the front there. All right, guys, I hope that was helpful. Reach out if you'd like any help and talk to your trainer to see if they have more specific recommendations on this.